Welcome back. Today, people living with HIV can expect to live as long as the general population thanks to discovery and development of effective treatments. Last month marked the 30th anniversary of CROI, a medical meeting that brings together scientists and doctors from around the world to share the latest advances in HIV research and progress. Joining us today to share some of the latest news from the conference is Chief Medical Officer at ViiV Healthcare, Dr. Harmony Garges. Hi, Dr. Harmony. Thank you so much for being here.
Hi, thank you so much for having me.
So let's talk about this meeting. How has living with HIV changed from decades ago to today?
Well, there's been so many changes, and thankfully we've made huge progress in HIV treatment, moving from the early days where we had no effective therapy to where we are today, where we have multiple options available for patients that are simple regimens that are generally well tolerated. And these advancements in treatment have really allowed us to focus on other aspects that are important to people living with HIV, such as their preference for therapy, their quality of life, and really tackling things like stigma and discrimination that still very much exist for people living with HIV.
Yeah, and so how has the HIV treatment kind of progressed during this time, and where do you think it's going next? I know you guys just had that conference, so I'm sure a plethora of information was shared. Where do you think we're going next?
Absolutely. So again, the treatment advances have taken us from the old days where people had to take up to 20 pills a day, very complicated regimens that were poorly tolerated, to where we are today, where treatment choices can include, one pill once a day to treat HIV, or even long-acting regimens that are administered every 2 months to treat the virus. And so, one of the highlights from the conference that came was related to positive findings from our study that we did, the SOLAR trial, that really compared these two treatment options, this popular daily oral pill known as Biktarvy with ViiV Healthcare's long-acting regimen known as Cabenuva, given every 2 months. And I'm happy to share those findings with you as well.
Yes. And so what will this data and all of these advancements really mean for the HIV community? I can only imagine, the hope that the HIV community has now and things like that. Expound on that for me.
Absolutely. So the findings from this trial are really important for the community because what they showed are 3 important things. First, this long-acting therapy was just as effective as the oral daily pill, and relatively well tolerated, with injection site reactions being higher in the long-acting arm because of how it's administered. But it also brought to life that people on oral pills still have a psychological burden with taking that medication. Nearly 50% of people on the oral pill reported challenges with taking that pill. And when they switched to long-acting, their treatment satisfaction improved. 90% of them preferred the long-acting. And so what this means to the community is that, we have new options that provide choices. So doctors really need to be talking to patients and understand what matters to them, what type of therapies they prefer. And I'm really hopeful this data will bring that to life.
Absolutely. Before we go, I have to ask you, what would be the #1 question that you suggest to someone to ask their doctor when, really discussing treatment options?
I think the #1 question is to simply say, what options are available to me, and make sure they talk about everything, the pills, long-acting therapies, et cetera. And then really the patient can share their preferences, what will match my lifestyle, what's important to me in terms of which therapy could be the best.
All right. Well, Dr. Harmony, I have to say thank you so much for being here with us today and sharing this information. I didn't even know about this conference, so I'm so happy that we can get that data out to everyone. Thank you so much.
Well, thank you. And if people want to learn more about this long-acting, I'd encourage them to go to our website, cabenuvalai.com, for more information. Thank you for having me.